Hi, today we're going to be talking about the immune system and different types of chemotherapies and cancer drugs to kill cancer cells. All these drugs that we're going to be talking about are cytotoxic agents, so that means they directly act on cancer cells to kill them. Both the oral and the parenteral chemotherapy drugs are on a list of high alert medications, and they will cause a lot of severe side effects to the patients that are taking them.
Since these drugs are so toxic, they require specific safety practices, including reconstituting and mixing chemotherapies in order to protect the healthcare worker. This includes an airflow hood, protective equipment like a mask and a gown, and gloves, and then it also requires training to administer the chemo as well as working with reconstituting it. Most of the chemos to prevent harm to the patient require a dedicated line for the infusion.
Cancer drugs have to be very powerful in order to kill the cancer cells, but as a result, they have many dangerous side effects. One of them is bone marrow suppression, which results in like low cell counts and like white blood cells, neutrophils, impact your red blood cells. And there's a term called nadir whenever your body's white cell blood counts are at their lowest. It's important to monitor that to make sure that the patient does not suffer from any opportunist infections or super infections. We also need to monitor for allergic reactions to it. And then one big side effect of the drugs is alopecia, where the patient loses hair here. And so it's important to talk with the patient to keep their body image up and give them a wig if they want it. And also there's extravasation, because you want the drug to only be in specific parts of the body, but there are times where the drug will leak out and damage other parts of the body, like the kidneys or liver. Another side effect is nausea and vomiting. It's important to monitor the client's fluid ins and outs to make sure that their fluid intake is adequate.
Patients taking these drugs need to make sure they're maintaining a neutropenic diet since they are immune compromised. This includes avoiding meat and eggs that are undercooked, unpasteurized dairy products, and unwashed, uncooked fruits and veggies.
There are specific pre and post assessments to do just to make sure the patient stays safe and it's safe to give them their chemo. For the pre-assessments, you should check CBC and neutrophil count prior to giving any chemo. This is to make sure the counts are within the established parameters before administering. The post-administration or assessments you should do are have client monitor for fever, sore throat, easy bruising, and unusual fatigue. They should report all of these immediately.
So the first class of drugs we're talking about is alkylating agents, and it can kill the cell or the cancer cell at any point of the cell cycle. It causes damage to these cells by alkylating the DNA, which causes cross bonds between the DNA, and it prevents normal cell functioning. So the first type is nitrogen mustards, which an example of this is cyclophosphonates. It was one of the first cytotoxic agents to be discovered. It was discovered in World War II because they used deadly mustard gas poisonings, and it destroyed the lymphocytes. So they used nitrogen mustard, and they figured out that it can cure lymphoma. And therefore, that was the first chemotherapy to be born. So the method of action is, like I said, is alkylates the DNA, so it causes these cross bonds that will prevent the cell from functioning. It's used in Hodgkin's, non-Hodgkin's lymphoma, multiple myeloma, and solid tumor that can be found at the head, neck, or ovaries. It will cause toxicity like hair loss, nausea, vomiting, bone marrow suppression, so they'll be immunocompromised, and renal toxicity, so make sure keep on checking the BUN and creatinine, and electrolyte balance, and it will also cause acute hemorrhagic cystitis, which is inflammation of the bladder and can cause bleeding. So make sure to report any nausea or vomiting or blood in the urine or pain with voiding. And then make sure to teach the patient to void before the dose of the drug is administered, because then it can help prevent cystitis. And it can also be given with Mensa drugs to prevent the cystitis of the bladder. Okay, so the next drugs I'll be talking about is the nitrosoureus, and the example of that is the carmustine drug. And the same thing, the method of action, it was alkylate the DNA, so cause these cross bonds and prevent the cells from functioning. This one can cross the blood-brain barrier, and it's more lipid soluble. This type of drug is used in metastatic brain tumors, Hodgkin's and non-Hodgkin's lymphoma, multiple myeloma, malignant myelomas, hepatomas, adenocarcinoma of the stomach, colon, and rectum. And it can also be given topically as a little wafer into the surgical incision of the cavity of a brain tumor. Same thing, it will cause toxic side effects like nausea, vomiting, bone marrow suppression, plum fibrosis, local thrombophlebitis, and extravasation of the IV infusion. So make sure to keep on checking the IV site for any redness, warmth, or swelling. Report any cough, short of breath, fever, nausea, vomiting, sore throat, easy bruising, and fatigue. And then you can take antiemetics as prescribed before and after the infusion of this drug to help with that.
The next class of drugs is the platinum compounds, which contains the cisplatin, carboplatin, and oxaplatin. And as you can see, all of them end in platin, so that's a great way to memorize that. They're very similar in the alkylating agents in their method of action. You can see by this picture, they kill cancer cells by forming cross links between double DNA strands. These drugs are very specific to testicular and ovarian cancer. Drugs are renal and ototoxic. They also can cause bone marrow suppression. Patients need to report any signs and symptoms of allergic reaction and peripheral neuropathy. You need to make sure you're monitoring your kidneys, your hearing, your weight, CBCs, and your urine output. You need to check your creatinine and BUN prior to taking the drug, and then weekly once you start taking it. And hydration is very important. Most times they will give you 2 liters of IV fluid prior to giving you the drug, and this is to help with your hearing and your kidneys.
The next drug we're talking about is anthracyclines. They're another type of cytotoxic drugs, but they're specifically for tumors. So it's for leukemia, lymphoma, neuroblastoma, or thyroid cancer, amongst many other things. And one of the most unique side effects of this drug is it causes the patient to have red urine and red tears, which is why it's called the red devil. And the way this drug works is, like the other drugs, it interferes with the DNA of the cancer cells, so it kills them. It also interferes with the enzyme called topoisomerase, which makes it so the cancer cells can't replicate the DNA and therefore can't cell divide. And when we're giving this drug, it's important to remember that it's cardiotoxic alongside the bone marrow suppression. So you don't want to give this drug to patients who have a history of heart failure or any heart disease at all. And because of this consideration, you also need to give a cardioechogram throughout the time you're giving this drug to the patient, just to make sure the heart is beating normally. And before you give the drug, make sure you know like the baseline heart rate and blood pressure, and make sure that after they take the drug, it hasn't elevated or lowered a significant amount. Anthracyclines end with the prefix rubicin. We have daunorubicin and doxorubicin.
Okay. Our next class is mitotic inhibitors, starting with vinca alkaloids. These are specific to the M phase, which disrupts mitosis. These drugs are used for leukemias, lymphomas, neuroblastoma, breast and lung sarcomas. With this drug, you should monitor BUN, creatinine, and liver functions, as well as CBC. Signs of toxicity with this drug include peripheral neuropathy, vesicant, alopecia, constipation, and colon impaction. Peripheral neuropathy can impact the dose of chemo needed for this drug. These patients should report paresthesia, including trouble doing dishes and putting on earrings or putting on buttons. The next drug is taxanes. These impact the G2 and mitotic phase. In the late G2 phase, they cause microtubules to stop the division during the mitotic phase. This is used for breast cancer and ovarian cancer and non-small cell lung cancer. Toxicity of this is peripheral neuropathy, hypersensitivity, skin rash, and bone marrow suppression. These patients should be monitored by their CBC for paresthesia, rash, and allergies. Nurses should pre-treat them with antihistamines, corticosteroids, and PPIs to prevent an allergic reaction. These patients should report paresthesia, palpitations, chest pain, swelling of the mouth, rash, and difficulty breathing.